Great question. On average, our umbilical cord stem cells range from the price of $5,500 to $6,500. The cost of this is definitely a lot less than some of the other type of stem cells that are used out there today, and of course with the best quality that we have found. That was why we use the umbilical cord stem cells. Well, they are not covered by insurance, unfortunately. Maybe at one point it will be. I like to answer this question in conjunction with explaining that just like LASIK eye surgery has been done for probably about 30 years, that is also not covered by insurance. Usually the second part of the question that people want to ask me is, well, why isn't it, Dr. Kaner, covered by insurance? And the answer to that is, I really don't know, but I do have a hunch. And my feeling is that there's a lot of doctors, professions that lobby against the stem cells to be covered by insurance. And my feeling is because, for one thing, is that there is money still to be made off surgery. So surgeons make money off surgery. No, just like vitamins, if you look on your vitamin bottle, it is not FDA approved. But the tissue banks are approved by the FDA, where the tissues and the stem cells get tested. So they are actually tested by the American Association of Tissue Banks, so the tissue banks are FDA approved, but the stem cells themselves are not FDA approved. I hear a lot about that, and that is one of the reasons why our doctors only use the best stem cells, which is the human umbilical cord stem cells. Some of the people who have had surgery or still needed surgery or even multiple injections are people who have used things like the autologous stem cells, which comes from their own body, either from the fat cells or from the bone marrow. Also, some people have needed maybe surgery if they're getting a less quality type of stem cell, like the amniotic stem cell. On average, our patients will start to see reduction in pain and swelling, some increased mobility on average within 4 to 6 weeks. There have been some patients that have even noticed within 48 hours reduction in some of the pain, but on average we like to ballpark around 4 to 6 weeks. Just like everything else, there is no guarantee. I can tell you by the screening method that our doctors rule in and rule out if a patient is going to be a candidate. We can guesstimate that we probably have about an 80% success rate. Listen, nothing is 100%. There is no magic bullet. If you find it, please let me know. But the most amazing thing about umbilical cord stem cells is that we're using the power and the same cells that makes babies, that makes humans, and re-injecting it back into different joints to repair, regenerate, and rebuild that tissue. A lot of doctors will say that stem cells might not work for you because of what they've seen when patients have been injected with the amniotic stem cells, or also with the autologous, which again comes from your own body. They don't have the high potency and potential to repair and regenerate just like the umbilical cord stem cells do. Great question. No, as we have stated before, we do not use embryonic stem cells. It is illegal in this country, so we do not use that. We use umbilical cord stem cells, which have the highest amount of growth factors, the highest amount of stem cells. Per cc, we can guarantee there are close to 5 million live stem cells per cc.